Show on the road.
This is a show, all right. All right. All right. Dusty, would you like to lead us in the Pledge of Allegiance?
Yes, sir. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone, and welcome to the Shawnee County Board of County Commissioners. It's August 13th, 2020. On my left is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2, and I'm Bill Rippon, and I represent District 1. I think I'd like to change the order of things just a little bit here today. I'd like to move Commission I-1 up to the beginning. I think we have a lot of people here that would like to speak. I do want to limit speaking time to probably like 2 minutes. I know we have a lot of people that want to speak, and I don't want to keep hearing the same thing. If somebody's saying something that's already been said, I don't know if we need to keep hearing a repeat of everything. So let's try to keep our comments brief and concise.
I will try to do the same. Good morning, Commissioners. Jim Krause, Shawnee County Councilor. Pursuant to your direction from last meeting, we prepared a resolution. Very quickly, before I go into the resolution, and there's not a lot to it, we received a lot of questions about the law surrounding this process. It's a fairly new process in terms of the commissioners issuing a resolution regarding a public health order, but the statutes involved are old. The first statute, 65-201, subsection A establishes that the Board of County Commissioners of each county shall act as the County Board of Health and shall hire a public health officer. The local health officer or local health program administrator shall hold office at the pleasure of the board. Subsection B is the new section added by the Kansas legislature this year that says any order issued by the local health officer, including orders issued as a result of an executive order of the governor, may be reviewed, amended, or revoked by the Board of County Commissioners of the county affected by such order at a meeting of the board, and then has a couple of additional requirements. I wanted to also point you to the statute that follows, and that's 65-202. That's the statute that goes into a little bit more detail about what the health officer is required to do. Let's see. C1 is the real pertinent statute, and that is the health officer shall make an investigation of each case of smallpox, diphtheria, typhoid fever, scarlet fever, acute, and I'm not going to read it all, including other acute infectious, contagious, or communicable, and shall use, and here's the key phrase, all known measures to prevent the spread of any such infectious, contagious, or communicable disease. Again, subsection 2 reiterates that it can be reviewed by the Board of County Commissioners. An interesting thing I wanted to point out, if the health officer does not do his job, not only can he be removed from office, but if he's found to be neglecting in his duties, he's guilty of a misdemeanor under the law. Now, these may sound funny, but if you look underneath where it says credits, you can find the source of a statute. These two statutes originally appeared in the state of Kansas in 1885. That's how long these statutes have been around. And when you start reading things like smallpox, diphtheria, those were the major concerns, and those diseases could literally ride into your town at any moment, and the health officer needed to act. Perspective for everyone, how long this issue has been around, how long we've had to deal with infectious diseases. It's more new to us because we've had the benefit of vaccines and modern science, but these issues have been around for a long time. So the statutes, as established by the Kansas legislature, clearly give the Board of County Commissioners the authority to review public health orders. Pursuant to your direction, my office drafted a resolution. What this resolution does, it simply reapproves all of the items in the latest health order that was issued by the health officer, issued on July 23rd to become effective July 25th. And what it does is it changes that order so that bars and restaurants can operate between the hours of 6 a.m. and 12 a.m. 7 days a week. So what it did was it moved the closing time from the health officer order from 11 p.m. to midnight on Thursday, Fridays, and Saturdays each week. That's the change. Everything else in this order remains the same. We added clarification of the enforcement provisions so that it's identical. It's an identical enforcement process to what we have with regard to the mask resolution. And the resolution would become effective immediately if adopted by this body today. And I'll stand for any questions you might have at this point.
Just for clarification, currently the order is that they can be open till midnight on what days?
Sunday through Wednesday, and then it's 11 p.m. Thursday, Friday, Saturday.
So this resolution would actually just add 3 hours of business time for these?
That's what it does.
establishments.
Yes.
3 hours a week?
Yes.
Okay. All right.
Thank you.
Thank you. All right. Dr. Penzino, you want to speak?
Good morning, Gianfranco Pezzino, Shawnee County Health Officer. See if I can navigate. When I was here on Monday, I shared some preliminary numbers. They are less preliminary now. So I wanted to show this chart. Please ignore everything that says here, August the 2nd. But what happened last week is that we had an increase in our number of cases that went up from 113 to 143. That's over 25% increase. It's the first time after 3 weeks of decline that our cases went up. And that essentially deleted any gains that we had acquired in the previous 2 weeks. So at the same time as that is happening, we are also noticing more localized outbreaks in the community. In businesses, one was linked to a bar the week before last week actually, and nursing homes. That's probably the most troubling part. What we said could happen all along, I think is happening. We just have too much virus in this community. And when there is so much virus, there is no way to keep it out from where we absolutely do not want it, like schools that are about to reopen and nursing homes. So we must reduce the level of transmission. I'm going to go faster because I know that we want to move. We know what works. This is an article that was published just yesterday in the New York Times about the role of restaurants and bars. We should make no mistakes. The science is there. Restaurants and bars more than restaurants actually, have a role in the transmission of coronavirus. There are measures that can be taken to reduce that transmission, but that cannot be ignored. Closing bars to stop coronavirus spread is backed by science, Associated Press, and picked up by U.S. News. You've seen this chart before. Now, is 3 hours really such a big deal? I think it is. First of all, you start chipping away one piece of a set of interventions that was carefully crafted and designed and agreed upon with the bar owners. You don't know where the results are going to go. Make no mistake, those are crowded hours. They told us that. That's why we did it. They told us that on weekends, the hours after 10:30 or 11 o'clock are the most busy and crowded hours of the entire week. People do bar hopping, and that's why we put the limit. This is already a compromise. So you may think that we should listen and compromise. This is already a compromise. It was negotiated with bar owners in exchange for being able to remain open. But the main point is that you have professionals that you have hired to conduct this business. And I would like to point out that between myself, the incident commander, Dustin Nichols, and the director of the health department, Linda Oakes, we have over 100 years of experience combined. Are unanimous in asking you today to not approve the resolution. Let us do our job. This is not going to be forever. We have targets. We've got to bring down the level of community transmission so that we can control the spread of those cases when they reach a nursing home, a school, or other settings where absolutely we do not want them. And the goals are here. We are currently 120 cases per week after last week. We need to go about half that number. And we were on the way to do that. We also need to have a drop in positive tests, in the percentage of positive tests. We are still studying what the ideal number may be for Shawnee County. The recommended value by most experts is 5% or less. We currently are at 7 to 8%. Finally, allow me please to read a short statement here. This is the second time this week that I appear in front of you. And each time requires hours and hours of preparation on my side and the side of the staff. I should not be here today. I should be in my office developing measures to allow schools to reopen as safely as possible, or assisting in investigating the largest outbreak of COVID-19 that we have experienced in Shawnee County in a nursing home. And while I do that, I should feel your support. The same way that all the staff at the health department who have been working overtime 7 days a week for 6 months should feel your support. The simple fact that we are having this discussion is very troubling for me. The damage that you are creating with this resolution and with this hearing and the vote you are about to take is something that is hard to measure. It's not about the 3 hours. You are increasing the division in our community. And you are letting everybody know that if they don't like some parts of a public health order, all they have to do is coming in front of you and be as loud as possible, and chances are that they will better data, but because they are loud and persistent.
Well, I'm sorry you were inconvenienced today.
Well, it's not an inconvenience. It's another opportunity cost, Commissioner. If I'm here, I cannot do my job.
You know, we pay you for a medical opinion, and there are many opinions out there from doctors, people who have had decades of experience as well, and it's your one opinion. But I have local doctors and other experts nationwide I read, and they have a different philosophy, a different opinion on how things should be handled.
Mr. Chairman, point of order. I don't know if this is the appropriate time for us to get into a discussion. If we have a question of the health officer, we should have that discussion. But I don't know that this is healthy for us to engage in a debate across the room at point of order. So, I mean, if there's questions that the chair has of the doctor, I mean, we can ask the doctor those, but there's going to be a time for public comment as well. Just looking to our parliamentarian to make sure we're following procedure.
It's usually customary to have the discussion over that, over the proposed action at the end of public comment and discussion between the three. And typically, we do require the interaction to occur from the podium to the board.
So you're saying we should have public comment first?
Yes.
Okay, we can do that. All right. Do we have to make a motion to open it up for public comment?
No.
Okay. Then we will now open it up to whoever would like to speak at this time. Please try to keep your comments brief, though.
Frankie Say, Abigail's. I actually wasn't planning on speaking today. I was going to allow my colleagues to do it. I'm just going to be really, really quick. The doctor said two things that I just want to address. The first thing was the agreement was made in the beginning of July about these hours with the understanding that we would be constantly looking at what was going on and have an open discussion about the situations. We haven't had that. I've gotten very little response back from the correspondence I've sent. So that's the first frustrating part of this. The science, I'm not up here to argue the science, guys. I'm telling you what the economic side of this is. All right, I'm not a doctor, I'm a businessman, and I'm telling you what the community is doing. I'm telling you what I'm hearing on the ground, what I'm dealing with the bar owners that are talking to me, and what I'm dealing with in my own personal business. We all understand what these restrictions mean, and whatever happens here today, we know we're not going to get anything better as far as our business being able to operate, probably until the end of the year. School's opening up, fall's coming. These numbers are not going to get to the numbers the doctor wants, and that was the second point. I asked in the beginning of July what numbers I needed to be looking at, what could I expect, what goal do we need to set? And they couldn't answer that in the beginning of July, but now they have an answer for it. And the goal set, it's putting it on us because we're the one industry that's taking the biggest heat for restrictions, and we have the least amount of control in these other places that this stuff is springing up. We can't control what happens in nursing homes. We can't control what happens in the schools. So when those numbers are going up, if you want to do restrictions on the bars because of things that are happening in the bars, if you're saying there's 20 new cases in bars this week, okay, let's talk about it. Let's figure it out. If we need to shut down early, shut us down early. If we need to change our policies within our bars, then we'll do that. In closing, real quick, I just want to say in all the research a month ago, I am no longer an anti-mask guy based on what I've learned of the other counties with masks. In population centers, the masks are having a positive effect, and I want our community to understand that. In rural counties, not so much, but in the Shawnee County, these masks are absolutely making a difference. So please adhere to that at least. And that's all I have today. Thank you.
Mr. Chairman, I do have just a couple of questions. Frankie, the current regulations, July the 2nd, we had the rather large discussion at the county commission meeting. We deferred any action
Correct.
until after the 4th of July to allow the bar owners, Dr. Pizzino,
Yes.
the health agency,
Yes.
Dusty Nichols, to sit down and craft a resolution that came back to us after the 4th of July.
Right.
You were part of that discussion.
Yes, I was.
And it was the consensus of the bar owners as well as the health that came up with these hours. It was a coalition and a collaboration that came up with the hours.
It was based off the understanding that we would continue to revisit this every couple of weeks.
Okay.
And we're not revisiting that. It's been, what, five and a half weeks now we're going on?
But
And we haven't revisited it. I haven't been, if we had known what the goals were in the beginning, I may not have agreed to that.
all right, but that was going to be my question. Because wasn't it 2 weeks after the rules went into effect, or less than 3, that you... and
Not
your-
for me.
But started to contact the commissioners wanting to know about opening up the
Yes,
restrictions?
there were bar owners that were contacting you within a couple of weeks. And that is not my position. My position has been, the understanding from what I've learned from the health department is they need to see 3 weeks of trends. We had seen 4. And I'm sorry, that in my opinion, the numbers looked really good. Apparently, they're not good, according to the doctor. They're not good numbers. I thought they were good, based on the number of hospitalizations dropping significantly, the number of cases, active cases, the trending down of new cases. again, I'm going off of the information I can get online and not anything else. And so the understanding of myself and my colleagues was we were doing the right things, that what we were doing was working. And we just felt that the hours that the restrictive hours was the first thing that we could ask for to slowly kind of guide us back into normalcy. We don't expect, I mean, is what we're expecting to get to these numbers the doctor's asking, and then all of a sudden all our restrictions are gone? I mean, is that what we're talking about here? No, it's got to be gradual. So we're not even, at this point, we're talking about 75 new cases a week, and whatever the transmission rate or whatever new number they want to come up with, because it seems to change every 2 to 3 months on what the expectations are.
In the bar resolution, there are a couple of things that were agreed upon. One of them was the hours.
Yes?
Not sitting at the bar.
Yes?
The amount of people within the bar.
Correct?
The volume of the TV or noise. Not having any karaoke or live music.
Right.
And of those, across the industry, there are people that are not following the rules. Correct?
Yes, you are correct.
And hasn't that been part of it too, is the frustration is the impact to you from following the rules while others are not following the rules?
You have no idea the level of that frustration, but I have no power. I don't have an enforcement agency behind me to go fix this. All I can do is ask my colleagues, and most of them, a good majority of them, want what's best for the community. They want their businesses to be able to operate and function, and they don't want people getting sick any more than anybody else in this room does. And that is a fact. Are there your outliers? Yeah, but honestly, that's your guys' job to deal with. You know who they are. The health department knows who they are, but I'm not going to stand up here and tell you guys how to enforce this.
But that too is part of the frustration.
Part of all our frustrations that are here today. Yeah, and there's ways to do this, and there's things that we are the most regulated, one of the most regulated industries anyway. Between alcohol, the selling, and the ABC, and then the health code, and everything we have to jump through, we're used to regulations. We're used to a government guy walking into our places and nitpicking the details in our kitchens and behind our bars. That's nothing new to us. We're capable of doing that if you guys have that enforcement. We're capable of as an industry, we have to make these changes. Like, I hate to say it, but it's not 2019 anymore. We can't operate like that anymore. And it's very frustrating for me because I know what it's going to do, but we can survive in this environment if we have the help that we need from the community, if we have the help of what we need from our officials, and the guidance we need from it.
The doctor made the comment that this is just chipping away, and once we do this, expanding this, are the bar owners going to be back next week asking for another, and is it going to be back the week after, the week after, and so on?
So the doctor had said that we're doing this because we don't like the rule. Okay, sure, maybe, but the rule, in our opinion, at this point, based on the 50% capacity, because understand, all these restrictions hit us all at the same time. And in a business, when you hit us with all these restrictions, we need a little bit of time, just like you guys do, to kind of get a feel for what's going on. And the 50% capacities is making a huge difference. It's making a huge difference in our sales, but it's also making a difference in the crowding issue and the bar hopping issue that we've had to deal with. Because with only 50% capacity, people not moving around. I was sitting in my bar the other day, and I couldn't believe it. I saw almost every single customer walking in there with their mask up, walked to a table, pulled their mask down, ordered a drink, sat and ate food and stayed stationary. That was not happening in the beginning of July when this all first started. It wasn't. Okay, the community's mindset is starting to change. We see it. We're on the ground. We're in these places. Just allow it to happen. But at the same time, give us the opportunity to survive. And that's all we're asking, is to just give us a chance to survive this. We're willing to do what we need to do and do our part for the community, but allow us a chance, a fighting chance at this point. And I know 3 hours doesn't sound like a lot, but it is. It makes a difference, you know, that's an extra, if we're making $100 an hour in sales, that's an extra, you know, $300 a week, $1,200 a month, that's our electric bills. You know, it doesn't sound like a lot, but it is. We're on a shoestring right now, and every little bit matters.
Commissioner Cook, I think we need to be flexible too, and, you know, what if our numbers suddenly get much better? Maybe then we can loosen restrictions more. Or what if it gets worse? We would certainly put
And
on more restrictions.
You would.
And-
But we just have to be flexible.
If we were looking
It's
at-
conditional.
If we were looking at our numbers of transmission, we were headed in a better direction.
Yes, we were.
This week, not so much.
What caused that?
But,
We're wearing masks.
but
We have
this
these
week, not,
restrictions in place.
but we have to look at, you said we have to be flexible.
That's
By
right.
the same token, I don't know that we had hit that level yet. I believe that we need to see at least a minimum of 6 weeks of that decline. If we had continued on the same trajectory, 2 weeks from now, I think we would have been at the levels that the doctor was talking about, had it continued in that same trajectory without an uptick.
So Commissioner Cook, I'm just, from the group of people that you guys are talking to at this point, we've been getting absolutely slammed with the 2 more weeks since March.
Well, but the problem is,
And you guys-
Frankie, it takes 2 weeks for anything that we do
Agreed,
to take effect.
it does.
So anything that we do today, we won't know the impact in July. It took 2 weeks before we started to see a decline in numbers.
Right.
Then we've had 3 weeks of declining. This week is the 6th week. Our numbers are up for the week and will probably end up for the week. Now, is this an anomaly? Is this a bump? Will it go back down? We haven't seen that yet.
So I'm just going to say that the burden placed on our industry when we can't affect how the nursing homes are operating, how the hospitals are operating, how, you know, other industries are operating, and there's cases coming out of those, but that's being tied to whether we get our restrictions lifted, that's my biggest concern.
So, for a perspective, March the 12th of 2020, 5 months ago, was the date that we shut the schools. We've only been working with the pandemic for 5 months. I say only, it feels like it's been 50 years.
Yes, it does, sir.
But 5 months in the grand scheme of things is but a blink of an eye.
It is. And in 5 more months, it's going to be another blink of an eye, and there's going to be
So-
businesses closing in
I
those 5 months.
I understand that I understand the pressures and the constraints, and I empathize. But I also think that, you know, my father taught me long ago the whole line. In this context, some have to be responsible for the entire public health. And so I empathize, and I
agree.
want to have those, and had we continued in the same line that we were at, again, in my mind, where I was at, was I think that we would have had a valid discussion if we had had at least 2 weeks more. And I know 2 weeks, it's a cliche, but if we had had 2 weeks to implement plus 6 weeks of declining, we would have been at the level we were at before the 4th of July, if it had continued in that same trajectory. But that's not the case today, and it was too early. So,
Very well.
Yeah, you know, these 2 weeks, that's thousands of dollars to these guys. And not only is it just money out of their pocket, it's people that aren't employed during
well,
that
then
time.
maybe it's time for us as a commission to step up and help the industry with some of our CARES Act money. And that would be maybe a discussion question for us later today.
If that can get to our staff, that's what we need right now, because our staff is hurting just, you guys don't even understand how much money some of our staff has been losing because of the hour cuts and the a lot of faith we're going to get much more help from the federal government at this point. So whatever you guys decide to do here, we want to work, we want to do our jobs, we want to support the community, and I cannot reiterate this. I feel like that maybe the doctor thinks I don't care about people's health, or you guys, I absolutely care. Every one of us do. I just feel there's a better way we can do this, and I feel like giving us just a little bit that we're asking for, we understand there's nothing else coming in a month and a half. We're not blind to it. We've been watching how everything's, we know that we got a whole nother fight that's about to happen. So we're just trying to get a nice base of business that we can kind of learn what is going on a little bit better, continue to implement the restrictions, and hopefully, at some point, we can work on enforcement of the industry, because it does need it. It needs it. I don't want to ask for it. I don't want another government agent coming into my place, but if that's what it takes to keep my business operating and running, then that's what I'll do. And I know all the other bar owners would be okay with that as well if it keeps their businesses open. People are going to gather, and this is the understanding everybody needs to have here. The entire community needs to have this. People are going to gather. They're going to get together. They're going to drink. And you're pushing them out of an environment that we can at least control and that we can at least track, and you guys can control and track. But that's your guys' decisions. I mean, I've said my piece. I said my piece Monday, and whatever you guys decide is what you decide, and we'll have to live by with whatever you guys decide here today.
Thank you.
You know, in the last declaration, emergency declaration that the governor sent out, the first thing she listed was economic recovery. And we're fighting two fronts here.
Yeah.
We're fighting an economy war, and we're fighting a virus. And you can't drop one or the other. You're fighting both of them right now.
And we're willing to sacrifice. We're willing to fight, guys. We really, really are. But we got to have some help.
And we choose, in some regard, who makes it and who doesn't. And we just need to help we're talking about 3 hours a week. 3 hours a week. But it can make a big difference in their lives and the lives of their employees. 3 hours. We've had one case related to a bar. Is that right?
That's
One
question
case
Doctor would
related
have
to a
answer.
bar.
They don't give me that information.
But
Mr. Chairman, that's not correct information. There have been many cases related to bars. There's been one recent one,
well, one recent one.
but there's been many cases related to bars.
I wouldn't use the word many, sir. I would use, yes, there are cases in bars. I'm not going to deny that are we the safest place to go? No, come on. Everybody knows, when you get together in a crowd and you're talking, it can be transmissible. Nobody's arguing that science. I'm not up here trying to rewrite, the medical books here. I'm just saying that we can continue to do the things we're doing, try and get more of the local and national chains on board with some of this that are in our county. I'm not going to name names, but I've been to several restaurants where they are not monitoring their waiting lines, and people are just clustered up into their little waiting area waiting to be seated. And if there's an agency out there that can start enforcing a little bit of this, everybody else can fall in line, and it will make a difference. Am I going to say it's going to eliminate the transmission of this in bars? No, of course not. But it's also not going to eliminate the transmission in your home or in a school or at work or at a county commissioner meeting. So unless you're going to lock us all in our homes again, you need to expect to see a case or two coming out of a bar or a restaurant or a school, or just lock us all up again, and let's see how that goes. Okay?
Okay. Thank you.
Thank you, gentlemen.
Let's take this off. Drop it down a little bit. Okay. My name is Gina Constant.
I'm not a bar owner by no means, so it took me a while to get all this down, but I'm here out of respect for our legal bars and restaurants, okay? And all the business owners in the capital of Topeka, which needs to set a positive example of the state of the capital of Kansas, okay? I'm a promoter, I'm an event coordinator. I've done many charitable events over the 25 years that have supported child abuse, cancer, diabetes, the homeless, and the veterans, okay? I do these benefits for these victims, but that I raise money for the revenue without these bars and restaurants for these Topekans in needs. I would like to acknowledge you require 50% social distancing at these establishments, but require them to pay 100% of their expenses of operation from their business, which includes taxes, their rent, their employees, their food, all their vendors involved, when realistically, they might, bring in 50% of this or less during these trying times. All of these establishments who are non-franchise businesses, they're local operated, who have put their own personal homes, businesses, retirements on the line to provide for their families and their employees and their lives and grow and raise their families here in the capital of Kansas, Topeka, and the state. The state collects huge revenue off these businesses. Why would you want to force these businesses out of work, which would not raise any revenue for other vendors or taxes? How do you explain and enforce the law you established, and how can you decide what hours COVID mysteriously comes out? At 11 p.m., 10 p.m. Would you and the health department please think rationally of the future of these businesses? And more importantly, their families. And the public to have the opportunity to take their families and friends out for entertainment, friendships during these trying times. We're all stuck inside. It's not just bars. It's grocery stores. I walk in this courthouse and I can get this. It's not just a bar. It's not just a bar that has this. How is it fair for the bars and restaurants that comply and clean, and I know they do, most of them do. I'm one that cleans a lot of these bars and helps. And even report positive COVID and voluntarily close their businesses for the safety of the public. And the local media throws the bars under the bus for being honest. How is that fair when they're doing what they're supposed to do? And the other businesses that break the rules that are not being enforced profit from the other bars that are doing what they're supposed to do. They're closing when they're supposed to, but you have numerous bars, and you guys know who they are, that are not following all your guidelines. So those bars are breaking the rules, profiting without any repercussions on this. None whatsoever. This is an injustice, total injustice, to what this country stands for. To be able to buy, own, and operate your own business. Please think wisely, and preserve these businesses to provide freedom and entertainment for the city. It's not just bars. And I agree with what Frankie said earlier. I can stand in line, elbow to elbow, in restaurants. They don't care. They don't wear masks. But why is it most of the bars here in Topeka have masks on? Their employees will sit in the kitchen with masks on. They can't breathe in a hot kitchen. But they're doing what they need to do. And because a couple bars have been honest to you guys and told you guys what was going on, so you're going to throw them under the bus. How is this fair? And that you're not letting them do it. These guys are losing $20,000, $30,000 to $40,000 a month. They have put their blood, sweat, and tears into these bars, and I know this for a fact. You shut these guys down, they're going to lose their homes. They're going to be on the streets with everybody else, the vets, everybody else. They can't afford to do this anymore. They're mortgaging homes, they're taking money out of their accounts, they're borrowing, they're doing what they can to keep their business open. Why is that fair? When they have to close at 10, they have to close at 11. But you can drive across town, and people are open until 2 a.m. And you guys know this. But how do you enforce a rule that you put on these bars? You're not doing it. And quite frankly, I don't think that you guys understand or know how to enforce a rule. I truly believe you don't know what to do. None of us know what to do. We're all going day to day. But if you're going to set out a rule for 35 bars in the state of Kansas, enforce that rule. Go to those bars that are open at 2 a.m. Don't go to the ones that are closing at 10 and 11, that are cleaning and sanitizing. Do not have bar stools up against their bars that are doing the proper thing. That's who you guys are nitpicking at. You're not picking at the bars that aren't following your rules. So I'm here, and not as a bar owner, but I'm losing money. I live on disability. I don't get $600 extra a week from unemployment. I don't get unemployment. So me doing this, I lose my income for the whole year. But I'm not helping any bars. I'm not helping the money that I raise for cancer, diabetes, that stays local here in Topeka. There's nothing I can do. You say no entertainment. I do. But there's other bars that are still doing it. You say no organized runs. We're not doing them. So I can't help state of Kansas. I can't put money in the hospitals for breast cancer. I can't do these things. I can't help these bars stay open. But you want them to pay 100% of their taxes. And they better pay their taxes in March and April. They better pay their liquor license. They better. How do you expect them to do this when they're making $500 a day, if they're lucky? I truly do not understand it. I'm not a doctor. I've been in the medical field. I don't like these. I wear them. I have heart issues. I have health conditions, but I'm still wearing them. I'm doing what you guys are telling us to do. So if we're doing what you tell us to do, why are you not enforcing your laws?
Gina, in the interest of time, if we could wrap it up here, keep, so we can hear some of the other speakers.
I'm fine. I just had a question.
Okay.
Enforce your laws.
Thank you. I'll remind you, we're going to try to keep these speeches brief here.
Mr. Chairman?
Yes.
If we could have maybe Mr. Corral just kind of signal when we get to like the 2 minutes.
That would be good.
Thank you.
2 minutes?
Yeah.
2 minutes is fine, yep.
My name is James Prout. I'm the owner of the Dutch Goose. Over these last few months, I've heard a lot of talking. I've heard a lot of suggestions. Something that was talked about earlier was, when we initially started this, we worked with the doctor. We wrote our own restrictions. We did that in good faith. We brought up issues to Dr. P and Dusty that they weren't even aware of. We did that for public health. We did that to maintain our livelihoods. And we did that because it was the right thing to do. There was a talk of professionalism earlier. Professionals keep their word. We have kept our word. We have tried to continue the conversation. The word has not been kept by the other side. We know this virus is real. We know that masks work. We know that social distancing works. We also know that we are being blamed for certain things that are happening, and it's not us. You know, you talk about, oh, there's this many cases of COVID in bars this week. How many cases of COVID were in Walmart this week? Can anybody tell me that number? Anybody have that number? How many cases came from big box stores this week? Nobody can tell me that number because you're not keeping track of it. You're picking and choosing winners and losers at this point is exactly what you're doing. I have a family to feed. I have employees that I have to take care of and make sure that their families are fed.
James, that's 2 minutes, so.
Mr. Chairman, before
Yes.
James goes, James made an allegation that the word was not kept by the other side.
Mhm.
If I could ask him to elaborate as to what he means by the word was not kept by the other side.
So we were to keep open communications between one another, the two parties, the bar owners, and Dr. P and Dusty. We have had a very hard time getting responses from them since our initial meeting that we came in here and spoke with you guys. You know, I understand there are some vacations taken, you know, people need personal time. That's great. We don't get afforded that opportunity. We have to fight for our livelihoods every day, and we have to keep our communication end up, and when it's not reciprocated, it's beyond frustrating. Beyond frustrating.
Okay, thank you. Thank you, James.
Morning, Commissioners. My name's Sean Ryan. I own a local establishment, Ryan's Pub, here in town. I just want to cover a couple of points that I haven't heard mention of. If you remember, a few meetings ago, probably 6 or 8 weeks, the topic was we didn't want to overflow our hospitals. That was the original thought, correct? We shut everything down so we didn't overload our hospitals. You know what the current count in the hospital is right now for COVID per Shawnee County site? 4. That's all that's in the hospital right now. So we have made some very positive impacts in that direction. And it appears that when we work on one target to get that, then there's a new target set. So we now have to meet something else, and it perpetuates this issue that we're here today again to discuss. So one of the things for me, I'm a small bar, I'm probably small potatoes to most of these, but the media and the medical advisors have done a great job of making bars the villains in this pandemic. Regardless of what restrictions you have put on my facility, my numbers are down. The restrictions and the portrayal to the public, I'm down that people that come into our bar. So when we ask about these hours, and I originally was going to talk about the 17 hours because that's what we've been cut from a normal week. For us, you know, if I have, say, 15 people in our bar, they buy a drink an hour, $5, that's $75 an hour. So that's $75 an hour times that 17 hours in a week is $1,275. Now you take that times 4 weeks, that's $5,100 worth of revenue. That's important cash flow for a small guy like me. So when you're asking why these hours matter, that's why they matter. The people that are coming in to our establishment at that 11 o'clock hour are the second shift guys that are getting off. They're going, that's their 5 o'clock, if you will. Just like anybody that works day shift, they go into the bar, grab a bite, sit down with their friends for a couple hours. That's their life. Their life is rotated 8 hours from the rest of us. So that's their time. So the people that are sitting in my bar at 11 or 12 o'clock at night are the same people that are going to still be there at 1 or 2 in the morning. We're not getting a flow in and out of different people and mixing.
Here, time's up here.
All right, I just want to close by saying, you know, I don't envy your job, doctor. You have a responsibility for his position, and I don't envy the stress he's going through. But somebody has to help look out for the business side of this pandemic to ensure that we maintain an economy as well. And that gentleman is you. Thank you for your time.
Thanks, Sean.
Mr. Chairman, I noticed that we have some people standing at the back of the room. If you're not able to be seated or coming up to the podium, please step back. We do have overflow into the break room cafeteria area, so we do need to respect that unless you have a seat or you're walking up to the podium, please stay in the hallway socially spaced or in the cafeteria.
My name is Susan Holm, and I'm here to speak to support the petition of Dr. Pacino to follow the rules that he has established. I have never owned a business, and my heart goes out to the business owners right now. The lady that spoke a couple minutes ago was saying, how is this fair? It's not fair. The COVID virus is not fair to anybody. But I see it from a little different point of view. I was a teacher for 50 years. I have grandchildren in school. My daughter-in-law is a teacher. My son is a teacher. My other son is a minister. He has not yet opened his church to open services. He does his counseling, his Bible study, and his church services all virtually because he believes it's much safer that way. I'm very worried about my grandchildren going back to school. I was a teacher, as I say, for 50 years, and I know that schools are germ factories, and I don't see how opening the schools is going to do anything but proliferate illness at this point. I live at Brewster Place, and I feel very blessed to live there. I live there with my husband. My brother is also there. My brother is in one of the main buildings, and we have Brewster has been exceedingly conservative in their rules, and it's paid off. I couldn't even go up into my brother's room to help him find his medicine one day when he had lost them. He loses things all the time. He forgets where he puts them. And I knew that if I went up to his room, I could find what he was missing. But I had to get permission to do that because we weren't allowed to go into that space. Even now, when we're allowed to go into that space, I stop and have my temperature taken, as we did coming into the courthouse today. And I was chafing at those rules for a while, at the limit of social contact. And then I realized how well it had paid off to limit that social contact. Brewster has had no patient, no resident at Brewster has had COVID, has tested positive for COVID. They've had 2 or 3 of the outside employees test positive, and they're immediately not coming to our campus.
This is your time, so thank you.
Okay, so I support the rules that Dr. Pacino has set out, and I think that they're helpful. And I'm sorry that it's difficult for businesses. And I hope that the unfairness of the COVID virus ceases soon, but we can help do it.
Good morning, Commissioners Cook, Rippon, and Mays. My name is Karen Rooney Cuevas, and I am a retired registered nurse. I was a nurse for 40 years, worked in a lot of different areas, emergency, cardiac, coaching, all kinds of things. And within those jobs, there was always one common thread, and that was we deliver nursing care based on best practices and standards of care. That's the way it is today in the hospitals. That's what our medical folks are following, standards of care. In retirement, stay healthy, and guess what? It's all based on science. So I'm here today. I've been listening to all that's been talked about with the bar owners, and my heart goes out to you. I do not have the answers, and it's affecting so many people. My daughter is a hairstylist, and she can't work full-time. She's losing money. There are so many people, so many businesses that this is affecting. But what we do know, based on science, is that the virus spreads when we are in closed spaces and when people are not following the rules of masks and staying apart and washing their hands. What can we do about that? I don't know. But I do feel that we need to follow the advice and the recommendations of our public health officer. Those folks, Dr. Pacino, his staff, Mrs. Oates, Dr. Oates, they're the experts. They follow all of this. They know what's going on. So I'm here today pleading with you to make a good decision, lead by example. You know, the healthcare workers, they're following best practices. They are in the trenches. They're getting our folks well. I know it's a small number right now in the hospital. Isn't that wonderful that we've been able? Okay, but one more thing. I just do feel that we need to uphold the recommendation just for a little while longer. Let's see the numbers go down. Do we want to backpedal and open up more and then see the cases rise and then have to go back? Let's be smart. Let's let our healthcare specialists make the decisions, and let's get this virus taken care of so that we can all get back to our livelihoods. Thank you so much.
Thank you. Thank you.
My name is Janice Haney, and I am simply a resident of Shawnee County. Whether the bars are open or not, or whether they have longer hours of operation, it's not going to affect my evening or weekend plans. But I felt that I needed to speak out after I watched Mr. Saya's request to open bars an additional 17 hours a week. And then I heard Dr. Pizzino say that he would not change the order. And then he said, I quote, "You can hire me, you can fire me, you cannot tell me what to do." I wondered what would happen if he were fired and he had to experience trying to replace a loss of income with restrictions placed on him trying to replace that income. That is essentially what his order is doing to the lives of so many. This order ultimately does affect me because it affects the economy of our community's businesses, which touches all of us. There's been a lot of incorrect information regarding data and science, and downright intentional deception. We can all think of the case recently with KDHE Secretary Lee Norman and the masks. This evidence has been used to grab control of people's businesses and livelihoods and to dictate the unhealthy practice of wearing masks. We are grown adults. We should be given our liberty back to make decisions for our good and for the good of others. You've seen the responsibility that a lot of these bar owners have taken for that. And we need to accept the responsibility of those decisions. We don't need the experts being our mommies and daddies. We're grown people. These bar owners and other business owners, they are putting safe business practices in place because they don't want to hurt their businesses. So I'm asking the county commissioners to do right by all of your residents. Start focusing on healing lives by healing our economy, and stop the tyrannical overreach measures that have found their place in trying to stop anyone, anywhere,
Janice,
from getting
your time's
sick
up.
anytime.
Thank you.
And if I may, I'd like to give you a copy of that opinion.
Sure.
Hello, I'm Phyllis Setchell. I'm in Topeka, and I'm a retired professional, health professional. I have a Bachelor of Science degree, so I'm fascinated by studying the body. And I'm looking at what we're talking about, and I have some questions. I would like to know, what are cases? Does that mean someone with symptoms who has COVID-19? Who has the answer for that?
Or you mean if they're a lab? Okay.
Well, okay, but it's okay, because of what I'm seeing, what I've seen other data is that cases means you test positive for corona. If you have had a flu shot, you will test positive for corona, likely, because it's included in some of the flu shots. If you had a cold, you would have a corona component in your body that would test positive. This is not having COVID-19 and needing to be hospitalized or be treated. If we are going to increase the number of cases to get herd immunity, which we need to be done with this, we actually, by secluding ourselves, are stopping the herd immunity spread. Quicker we get 60% or more, there's not going to be anyone to infect, and it goes away. But the main thing is we have, in the things that we're trying to do to compensate for this virus is wearing the masks, and the masks are not able to contain a virus. It's like having a screen door on a submarine. It is very, very tiny. The masks aren't going to be effectively stopping it. It may stop a few sprays of something, but it's not helpful. And there's a dental component now. Dentists have...
Phyllis, your 2 minutes are up.
Okay, well, I want to show this last thing. This, I hope all of you have seen. This is the chart, the monthly August COVID update chart graph. And the red line, well, the number of population, Kansas population, 2,912,000, percentage of Kansans tested positive was 31,145. That's 1.06% that tested positive. And deaths is 380. That is that's 0.01305. Why are we stopping economic development? This is 1/4 of what the flu epidemic was in 2019 and 2020.
Phyllis, we're out of time on.
Okay.
Thank you.
Gentlemen, ladies, thank you very much. My name is TJ Weber. I'm just a bartender here, an Army vet. I was actually a medic in the Army, which is pretty irrelevant here considering the medical expertise that is here. Just a couple things I'd like to discuss. One, some science that hasn't been discussed here today. And to lead into that, I'd like to discuss those 3 hours that we're talking about that everyone that feels is so important or not important for some. Those 3 hours were my job. I closed at the Dutch Goose for years. My job started at 9, closed at 2. Those 3 hours were my money. There's another colleague of mine who's here, and I hope she comes up and speaks later. Half of her money came from Friday nights. Thankfully, I don't have children, so it's not important for me to be able to do that. But for her, it is. But those hours are very important. Don't just think of them as if they're not, because they are. I know you guys have a very difficult job. I just wanted to make that, make sure that was stressed upon a little bit more. Now, the science I'd like to get into leads into those hours being cut, because my job was taken away because of that. And I understand we all have to make some sacrifices and do some things in these times so all of us can be better. And I think that's an important thing to discuss as well. None of this is win-win. We're not talking about win-win solutions here. We're talking about the best bad solutions. That's really what we're trying to get at here. And the science that I'd like to discuss, which I haven't heard any of the medical experts discuss or any of you even ask about, is deaths of despair. This is something that we know for a fact takes place. Science proves this, that when people lose their jobs, they become depressed, and they start using drugs. We know these things lead to death. We know that. And not just death, but mental health issues, a whole line of things that continue along that create things for years and years to come. And I just hope that especially the three of you and all the medical experts here who are giving you their advice, keep those things in mind. But that's all I have to say. I appreciate your time. Thank you very much.
Thank you, TJ.
Mr. Chairman?
Yes.
TJ, just so you know, at prior county commission meetings, we have had discussions about suicide, about crime. We've had discussions about the impacts of the economics. So we have gone through those in prior county commissions. While we may not have it discussed today, we've had extensive discussions in prior meetings. I don't know if the media's not gotten that message out to you, but yes, we've had those discussions, especially on suicide, looking at those, because those numbers are in mental health crises, looking at the admissions to Vallejo. So we've had those discussions.
Well, I just quickly, I was done with my point, but just quickly speaking for my own, since I was 18 years old, I moved out, and I fed myself, and I took care of everything by myself. Although I have a great family and friends who would never let me fall, who will never let me die on the streets. That will never be my story. But there are a lot of people who aren't like that, and it's not just suicides, it's the mental illness. There's a whole line of things that come along with people losing their livelihoods. And that's what we're discussing here today. We're literally discussing people who, my friend James, my friend Stacy, my friends who own businesses who've allowed me to work at these businesses, and a whole lot of other people who make their livelihoods off these things. And it's not a small thing. It just really isn't. Thank you, gentlemen.
Thank you,
Ladies.
TJ.
I understand. But also, we need to get the people who do not have a chair. We have way too many people in here just standing around. If you don't have a place, you need to be outside, okay? And there's standing for health reasons.
Hello, I'd like to just say, I don't know,
Could you give me your name?
oh, my name's Oshara Hayes. I'm here just to ask everyone to listen to our public health officer. I don't know a lot about the issues in the bars and a lot of other things, but I believe that the commissioners and others in the city have made sure that they got people who know what they're talking about as far as the health issues are concerned. I don't have the luxury of seeing if I can stay out late to go to a bar. I live on the side of town that has the highest rate of the coronavirus. So I don't have the luxury of doing that. I don't have a lot of luxuries that other people do have. And I need you to hear the voices of that don't have the luxury of staying out, the voices of those that don't have the luxury of being able to get tested whenever they may want to. I went to an event and someone had the virus, and I had to, it took a lot for me to get a test. And that was another thing I want to say. It takes a lot, especially if you don't have the luxury to do a lot of other things. So I just hope that people listen to the public health officer and his recommendations. Thank you.
Thank you.
Good morning. Please be seated. My name's Morgan Lynn. I am who TJ was referring to. I work at the Dutch Goose. I've been in the service industry since I was 18. I've bartended since I was 21. I've been at the Dutch Goose for 10 years. I know that most of people probably don't see bartending as a real job, and that's okay, but I'm really good at my craft. We have elderly people that are retired, with their family. They have nowhere to go right now. Or they do, they find places, but it's not the same. They don't have the people that they need around them. Elderly, widowed, widowers, things like that, that look to us for their daily interactions. I look forward to that for my daily interactions. I don't go out to the bars. I work at one 5 days a week. I'm home with my kids otherwise. If I told you I wasn't somewhat apprehensive about working and taking it home, I'd be lying. Everyone is. People that work at Dolan's are in the same boat that I'm in. My bar hasn't been able to open. We will run at 24 people. That will be our 50% capacity. I don't know if that's enough for my owner to even pay the taxes that he's going to have to pay for that month. I know that's weighed on him heavily as far as reopening. They're trying to take advantage of doing things. I've gone out and got a second part-time job. The 600 on unemployment helped. I've saved as much as I can, but now I'm making 50% of what I made before, even with a second job, between unemployment and trying to work a second job. And I'll have to keep that second job once I go back to work at the Goose, because at 50% capacity and limited hours, my income will stay a percentage of what it was. And I understand that. I'm more than willing to adhere to anything and everything that is put in place to keep the public safe. But again, I do feel that bars are getting kind of a bad rap. I don't think you're taking into account the people that work there and our passion for our jobs. So we will do everything that we can to keep our people safe as well. Thanks.
Thank you, Morgan. Anyone else wish to speak?
We can wait a moment and see if there are people in the hall or coming from the break room.
They have a bit of a delay on their telecast down there too, so.
Yeah.
Good morning. Monique Pittman, Shawnee County. First, I just want to, again, raise my objections to these Commissioner and Board of Health meetings in this small space. COVID-19 has forced all of us to change and make adjustments to stay safe. Many constituents do not feel comfortable coming here, and my hope is that you will find a way to change this venue. You asked for public comment, and now you're truncating people to 2 minutes after people have made a very serious effort to be here. So I really object to just 2 minutes. I had a lot more to say. I will try to keep it short. The low numbers indicating viral should be changed. It doesn't mean that we should second-guess science and data and override the orders and advice of our highly trained and competent health experts. I trust them, and so do many other people. They are trained to handle a pandemic unlike any of you. Low numbers means we need to stay the course. What seems like an easy change on bar restrictions is far greater implication that I see acknowledged in this room. If you change bar restrictions today against scientific advice, this opens the door to your changing restrictions without good reason on restaurants, personal services, gatherings, gyms, daycare centers, sports, etc. This is a dangerous precedent, and the door I am asking you not to open. Bars being in financial distress does not mean we should second-guess science and data and override the orders of the public health officer. I do want to mention the financial distress of bar owners, the entities that bring us to this point today of changing. As I mentioned on Monday, our public health officer is not the enemy. The enemy is the virus. And the reason we are in the difficult position we are in today with thousands of people dying all across America is because of the bungling of this pandemic by the occupant in the Oval Office and his cronies.
Your 2 minutes are up.
The pandemic is worse in the United States than in any other country because of the bungling of this pandemic.
Monique,
It gives me great pause.
Monique, your 2 minutes are up.
A lot of people went to a lot of effort to come here. I've heard you listen to many other people and let them drone on and on and on. This is not fair.
Anyone else? All right.
Do we need to send someone down the hall and check with?
Yeah, let's check, because there's a delay in the telecast. Did we lose Amanda somewhere?
She went to check.
Should we address right now the venue? And that,
Oh, yeah, I do want to address the venue. We're looking at at making some changes to the Great Overland Station where we can do our board meetings at the Great Overland Station. We have a few little issues we have to work out to make that possible. It probably will be let me look. The 24th is probably when we'll start having meetings there. Well, it's a bigger room, we can spread out, but where we stream these meetings and stuff, we have to get our computers and everything up to snuff over there, and some TV screens so that we can do presentations. So it'll take us that amount of time before we're set up. So we are addressing that issue.
That's it.
What's that?
Amanda says no more comments.
No more comments?
Everybody that's in there is on the agenda, so at this point, for public comment, we are done.
Okay, very good. All right. Did you want to make any further comments?
Well, Mr. Chairman, I don't know that it should come as a surprise to anyone in the room, but I am asking the commission to not make any changes to we have in place for the following reasons. On July the 2nd, we directed the health officer to meet with the bar owners. This was produced as a collaboration between the bar owners and the health officer. At that time of adoption, after the 4th of July holiday, the indication was given by the Board of County Commissioners that we wanted to see significant downward trends before we would consider making any changes. I know that I was beginning to get personally lobbied within 3 weeks of the adoption of our order to start expanding. I've held firm and steady that we should listen to our science, listen to our doctor, before we make any changes to the health officer's orders. I don't believe that we are there yet. We were getting closer at the beginning of this week. This week has not been a positive week for us to expand bar hours. I do recognize that we are talking about 3 hours, not 17 hours. But I think the greater impact is the science, the expertise of Dr. Pizzino. Now, when we look at the local impact, again, it is not about just the bottom line of a business. It is about the whole line of our public health. And at this point, I do not believe that we should be looking to expand those rules that we currently have in place. We should continue where we are at, revisit this issue weekly if needed, and I will indicate, Dr. Pizzino, I do appreciate the time that you do take to be here and the preparation that you take to be here. That being said, I also recognize that you take time to meet with KSNT, WIBW, the Topeka Capital Journal, other media. That is part of your public interaction to educate the public regarding the virus. This also is an opportunity to educate the public about the virus, but more importantly, educate the Shawnee County Board of Health, the Shawnee County Board of County Commissioners about the virus. Every opportunity that you can take to educate us is part of your job as the health officer. I also appreciate from the presentation made by Mr. Crowell that if you did not educate us, there are liabilities to you. And those go back to the 1880s. It is your job to educate us. So I appreciate all that you do in educating the community, but I hope you do not see this as an inconvenience, but you see it as part of your job duty. Thank you.
It is true. The bar owners did meet with our health professionals back in July 2nd. That was over a month ago. And I look at these things as they're local and they're conditional. They made a lot of changes to their operation, a lot of concessions they had to make. And I don't think this is a big change. It took time for them to see how these changes would affect their business. And 3 hours a week is not a lot, but it's money in their pockets to help them keep going. We hear about a business every so often that it's closed their doors for good. We had one just yesterday. Hate to see that happen. You know, I've heard the word science and data till I'm about sick of it. There is science and data for anything you want to hear, for both sides of, say, the mask issue. It's out there. There's science and data out there. We have experts on board, but there are a lot of other experts who have decades of experience on the national level, local level, and I hear from them. I've talked to them, and they have a different opinion. And a lot of times when you have a major illness, you'll get a second opinion. And we're putting a lot on one man's shoulders here. I've had a number of family relatives and who have been diagnosed one way, go to get a second opinion and get a whole different opinion. And thank God we did. That doesn't mean the first doctor was bad or made, incompetent. There was another opinion, and it finally worked out. Some other thing. I want to reiterate, too, that we're fighting two fronts. We just keep calling this a virus thing. But it's an economic thing. You can't separate the two. And adding 3 hours to these people's business is not that big a deal. I just don't think I don't know, I just don't even understand the brouhaha. You know, when the governor made that declaration, they changed the way, they changed the whole, or not politics, but the government, the way it works now. We have the ability to override a decision it's made because it's more than a virus. It's become an economic issue. That's why they gave us overriding power over the health doctor on certain issues. And I think this is one of those where I just don't think this is a big deal to add 3 hours to these guys' life. And it can make a huge difference on their lives and their employees. I just feel like it's what we should do. I would be irresponsible in my duties if I didn't explore the opinions of other medical people, and I do. So I am going to vote.
Is that your motion, sir?
That is my motion.
Mr. Chairman, I'm going to go ahead and weigh in here as well. I've looked at some of the other orders around the state, and going back to the fact that, one of the things that we keep hearing, if you read my emails, is listen to science, and so trust the health officers. So I went around and I looked at some of the other orders in the state. Riley County closes bars at 12:30, 7 days a week. And I would say that Aggieville probably has a lot more business after midnight than we do. Does that mean that their health officer, Dr. Gibbs, is not listening to science? Johnson County does not have any restrictions on bars that I can tell. Does that mean that their health officer, Dr. LeMasters, is not listening to science? Wyandotte County does not have any restrictions. Does that mean their health officer, Dr. Greiner, is not listening to science? Sedgwick County did kind of a unique thing where they listed all of the drinking establishments by name. Some are closed at midnight, some are closed altogether. They differentiated between what they call drinking establishments and nightclubs. Maybe that's where we need to go, but they have established that drinking establishments close at midnight. Does that mean that their health officer, Dr. Minz, is not listening to science? We're looking at adding 1 hour a night, 3 nights a week. And what it also accomplishes is a better understanding of our general public that at midnight, things shut down. Across the board, no matter what day of the week it is, bars and restaurants, except for curbside and delivery and whatnot, their dining rooms close at midnight. I think it's easier for the public to understand. I don't think that 1 hour a night, 3 days a week, is going to make a huge difference in our spread of our virus. Many people mentioned schools. I think we all can agree that once schools open up, there will be probably some increased community spread of the virus. But that's not to be attributed to bars and restaurants. That's to be attributed to schools. And I would not be surprised if after a few weeks of being open in schools that we have some changes there as well. We were presented on Monday what I would consider a false dichotomy of two options. Reopen the bars without any restrictions, or keep it exactly the way it is. There was no type of alternative option presented. So I presented this option that we have before us today, which is, in my opinion, a compromise. And I realize that people sat at the table and had a compromise at one time. But that was over a month ago, and the dynamics have changed. The paradigm has shifted. We need to look at something a little bit different. And this makes sense. It's not radical. This is very similar to what many, many other communities are doing right now. And so I think that this is probably what we need to do right now for all the reasons that I just mentioned. And so I will second your motion, and I'll be voting in favor of making it midnight, 7 days a week. Let's also, before we vote, I want to also mention that this order, in another way that it differs from the previous order, is that it unifies the enforcement component as well to exactly the same as what the mask order is. And so there were some discrepancies that have been rectified by us issuing this new order today. Nothing major, but it's something, and it actually probably helps a little bit as well. So I think that this is going to help these businesses a little bit. It's not what they wanted entirely, but it's better than nothing for them. And I don't think that this flies in the face of science in any way, shape, or form. So I would second the motion.
All right. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed?
Nay.
Motion carries 2-1. Next item.
Item 3, consent agenda.
I would move that we approve the consent agenda.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,030,543.99. The highlights out of the voucher report: $336,815.53 is Capers contributions. From the detention center, $311,715.66. The majority of that is Horizon, which is our health care for our inmates. And then finally, the one that makes up the third largest is the state of Kansas holding accounts, $151,270.12. Those make up the majority. The only other thing that I would add is that we do have under Motorola, on 911 telephone, Motorola Solutions, which is the software for the radio system, at $29,366. I don't have any questions. Would move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item A2, consider correction orders.
I would move that we approve the correction orders.
I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor say aye. Those opposed, motion carries 3-0. Next item.
Item B, Administrative Services, number 1, consider approval of the Coronavirus Relief Fund allocation guidance from Whit O'Brien's LLC to include share of funding to cities, school districts, and other entities within Shawnee County affected by COVID-19 expenditures.
Good morning, Betty Greiner, Director of Administrative Services. I'm here this morning to represent our Shawnee County Spark Committee, and I will give a little bit of a background. I'll go through the background quickly, but as you all know, the CARES Act awarded $1.2 billion to the state of Kansas. The state created the Kansas Spark Task Force. They allocated those funds into 3 rounds. First, round 1 was $400 million that was to go to counties and primarily for local government. Round 2 and 3 are state initiatives that they are still working on. Shawnee County, as part of round 1, received $36.7 million. On June 18th, you created the Shawnee County Spark Committee. It has 9 members, and a commissioner is on there, department heads, elected officials, and then there's 1 seat from the Greater Topeka Partnership. Since that time, we have been meeting twice a week. Initially, we set our priorities. Based on state guidance, our top priority was county costs. As you all know, there's a reason that they allocated these through the counties. The counties, with their Department of Health and those and emergency management, are really kind of leading the charge against COVID-19. So that was our top priority. Our next priority was other taxing authorities. That includes cities, schools, townships, fire districts, that type. And then thirdly, we were hoping to have some money to share with community-based programs for nonprofit organizations, private schools, small businesses, etc. You, as a commission, hired Witt O'Brien's as a consultant. It was a great decision. They bring an independence to this whole process that I think has been very beneficial. They have experience with this type of situation. They have contacts with the state Kansas Recovery Office, which has also been a review of what are eligible expenses and eligible projects. Matt Urchel, who is our team lead with Witt O'Brien's, he is on the call today. Matt, I would encourage you to and welcome any comments or further explanations that you might have as we go through this presentation. We began with soliciting the survey of the needs, what they had already spent, as well as what the future costs they were looking at. Each county department and each governmental entity were asked to fill out a survey that was a Witt O'Brien form that we used to establish the needs that we had in the county. Witt O'Brien has reviewed those. They have asked questions for clarity to determine if these are eligible costs. Then all of those costs were compiled by categories. We had more requests than money. So this has not been an easy task, and it's been one that the committee has taken very seriously. The committee was tasked to come up with an allocation plan. So with the help of Witt O'Brien, we considered several different things. We considered other monies from the CARES Act that some of these entities might have received. The schools, the school districts, as well as also the post-secondary schools, have already received money from the CARES Act, and the post-secondary schools will also be receiving money part of round 2 with the state. We also looked at those entities as kind of part of those that have not received money from the CARES Act yet. And then we looked at the most immediate needs for the county, for reopening costs and those type of things. We were kind of looking at that as one of our priorities. The committee unanimously approved the following allocation plan that I will go through with you. So we will start here with our broad categories that we have come up with in the allocation to each. The first is the county regional response expenses, and that includes those from the health department. And that we are recommending 41.5%. The next category is the cities. That includes, of course, Topeka is the largest, and I'll have slides for these breakdowns later, but these are the broad categories. That'd be 25%. The schools, 18%. The other taxing authorities, 0.5%. And then the community-based programs, 15%. Now, the category for the county may look high, but like I said, I kind of remind you that in a lot of ways, the county is kind of the one that is leading the charge on this. And from our consultants, I understand that this is within the range of other counties in the state. In fact, this is probably on the lower side of that. This is just a pie chart that kind of shows you the different categories and how much would be allocated to each. Allocations to the cities, these allocations were determined purely on population. That seemed like the most logical and best way to allocate these funds. The second are the school districts and the allocation to them. What we did on this, we talked at great length about this, and our final decision was we have an enrollment-based allocation. We started that out. That comes first, and that is $200 per student. And then we have an economic adjustment. That is based on the free and reduced lunch numbers for each school. There is a part of our agreement with the state of Kansas that says we should address the inequality of COVID-19 in some of the minorities. And these were numbers that are available to us to use to allocate some monies just based on that free and reduced lunch. Just like say it was the easiest way. We also have an allocation here to Caw Valley. That school that are included in Shawnee County in the city of Rossville. So since they're not totally in Shawnee County, but they physically have 2 school buildings that are included in that. So their numbers are based on their students within those 2, the students that reside in Shawnee County. And then here's a pie chart showing the different, the allocations to the different school districts. Then we also, as I said, allocated we're recommending to allocate 15% to community-based programs. And in our discussion, what we are suggesting for those programs would be they would include but not limited to support to area nonprofits for reopening measures, small business grant programs, PPE to individuals, business, and non-governmental entities, food security programs, and other essential service providers in the community who are unable to access state and federal level programs. So this is the proposal that the committee is making to you as the governing body that will approve this plan or make adjustments to this plan. We do have to submit a plan to the state of Kansas by August 15th. Well, since the 15th is a Saturday, we have till Monday, but a plan does need to be submitted to them by August 17th, which is Monday. Matt, since you're on the phone, do you have anything you would like to add to this?
No, I think the only items that I would like to add is I'm looking at the city allocations as well as the school district. When we specifically looked at their request, we felt that the most appropriate method here was to come up with a capped allocation. So instead of individually deciding what expenses to participate in, instead we wanted to come up with an allocation and allow them to prioritize up to that dollar value. So it gives them a fair amount of autonomy in determining what their priorities are based on how much money is available, and then just submit those to the county for reimbursement.
So we are asking for your approval of this plan. Once we have a plan, say it will be submitted to the state. If it is not accepted by the state as it's submitted, they will send it back to us, and we will have an opportunity to reallocate the funds and then resubmit it. So do you have any questions?
Any questions?
Mr. Chairman?
Yes.
Matt, can you talk to us a moment about the community-based programs as to what is an acceptable or unacceptable community-based program? I think there's been some discussion with other governing bodies across the state about that.
Certainly, I think when you're looking at the impacts of COVID-19, there's two different functions or there's two different types of impacts. There's direct impacts and then there's indirect impacts. The direct impacts are measures that you're going to be taking to help prevent the spread of the disease within the community and protective measures, whereas indirect impacts are a result of reductions in hours, closures, and reduction of individuals in an area, which then has downstream impacts on unemployment, housing security, food security. So the most important part is to try to address the added complexity that COVID-19 introduced into a particular issue. So when we look at, say, things like small business grant programs, what we're doing is we're helping with business interruption, but there is also an argument to be made for economic revitalization. So you can actually provide some sort of support for helping those businesses adapt to this changing environment and get to a steady state. So that could be things like purchasing new tables for outdoor dining so you can expand your footprint. That could be touchless point-of-sale terminal systems. That could be installation of plexiglass. Those are distinctly different activities than the federal government programs allow funding for. Most of the federal programs are more focused on payroll. So by broadening the eligibility criteria and actually focusing on how to get those businesses the support they need to become more self-sustainable in this changing dynamic, that helps actually boost those industries up. So those are the types of programs you can do on the small business side. Food security programs looking at food banks and harvests. Certainly most home experience interruptions and economic activity may also experience issues with food security. So help harvest type food bank type programs. We also put essential services. I think during an impact of a disease like this, you're going to have an incredible demand for mental health services, for just accessing benefits that are available and some of the complexities associated with that. So there are a lot of nonprofit organizations that provide that sort of bridge to access those benefits, and you can certainly support those entities and even expand their services. Is that helpful?
Yes, it is. On the small business grant part, are there limitations, again, on what small business grants can be made? And I know we're getting a little bit ahead of ourselves because that's a discussion for maybe down the road.
There are a lot of different ways you can structure small business grant programs. I think one of the most effective is allowing the business owner to prioritize exactly what their needs are. So not necessarily create such a broad eligibility range that you have a lot of administrative complexity with collecting documentation, but instead doing an immediate working capital injection to at least help them keep afloat, whether it just be for a temporary period or just giving them the autonomy to really determine what the best way to serve their immediate needs are, and then have them self-certify how they actually expended those funds. So there are some activities that you can't pay for, specifically things like property taxes or local taxes, because that would serve as revenue replacement. But working capital, specifically operating expenses, the funding can be used for those.
Matt, who would define what is a small business? Would that fall back on to us?
It would, yeah. And then there's a number of different ways that you can define it. Obviously, SBA has a broad range of that determination. For the SBA, payroll protection program, they were using a relatively high threshold. I think a good guardrail is somewhere between 50 to 100 employees, and then ensuring that they're not a publicly traded or franchise location because those entities often have access to other funding opportunities.
Matt, on the school district, the Kansas rules had indicated that the school should be funded on where their district is located, Yet in this case, we are going to be providing income or some of the money to two schools that are located in Shawnee County, but their district is in an adjoining county, Pottawatomie, headquartered in Pottawatomie County, but because that county had determined that they were not going to extend money to those two schools in Shawnee County. If we were to have an audit at a later point, is that something that we should be concerned about?
No, I think the one thing we will want to understand is just to confirm that Pot County is not actually going to provide any funding for all the enrollment of students, and it's just for the enrollment of students within their county. But no, that shouldn't present itself to be an issue. Ultimately, the funding is provided to provide benefits for Shawnee County residents. So if those students actually are attending school within the county, that would certainly qualify.
And will that school district need to provide proof that that $95,723 actually went to students in Shawnee County?
Not necessarily. Obviously, there are a lot of administrative expenses associated with that are going to be trying to put that guardrail on or understand exactly how that funding will be utilized. But I wouldn't say that would raise an audit concern if it wasn't. Obviously, again, there's benefits of administrative benefits of providing it to the school district itself. That said, we can certainly work to try to put some additional guardrails up.
I guess my concern would be that you might have a school district that's double dipping or a county that's not meeting its obligations. And that, again, just raising that as a concern.
And that is a concern that we talked about as part of our committee meeting, because that does present a problem when all of the costs for one school district is not coming through one source. And we did talk about that, that we will have to work closely with this school district to determine that we're not duplicating costs for reimbursement. We also, the committee also discussed each of these entities will need to agree to a subrecipient agreement with us that the counselor's office has been working on, that they will have to sign before they receive any reimbursement. We discussed the need for Caw Valley's subrecipient agreement to have something listed in there that these costs will be related to those two schools that do reside in Shawnee County.
Matt, what does the future look like for private schools? Will they be eligible for any funding?
Some will, and some private schooling was actually to qualified educational institutions, lower education, or what they call lower education agencies, so LEAs. And I think that when we specifically looked at the schools and determining the allocation, our intent here was to try to provide enough funding for them to get open, understanding that Congress is likely to act in the next, say, 6 weeks on an additional relief package, and we do know that there's consensus between both the House and the Senate on schools being a primary focus of that relief. Now, granted, it will take 30 to 45 days after any sort of legislation before that money trickles down. But there is definitely a prospect that by the end of the year, they're going to get another injection of funding. So our intent here was to try to provide enough funding for them to really support this first, fall semester and certainly the reopening measures that they're going to incur. Now, this was focused on just the public schools. We actually had conversations about the ability for private schools to be included, and what we determined is that we would potentially fund those through the community-based programs as opposed to a direct allocation that the school districts are receiving. But many private schools did actually receive money from the CARES Act as well.
Thank you. Any other questions for Matt? Yes.
Yeah, what about early childhood programs, preschools, daycares, things like that, which have been open this whole time and had probably quite a bit of expense? They're not taxing authorities in most cases, but they're also, a lot of them are very small operations. I mean, are we expecting to be completely flooded and inundated with requests from in-home daycares and things like that? Would they be eligible for this?
So there's two ways that they would be eligible. The community-based programs, when we talked about other essential service providers within the community, they would certainly fall within that. I think the question you have is does that qualify as a small business, or is that a nonprofit or other type of community-based entity? So, we can look at that area specifically. Just another consideration around child care providers. That is a topic that came up quite often during our meetings, specifically around, if child care is directly tied to economic activity and individuals' ability to participate, and how the school impacts and potential school closures have impacts to the economy and individuals who aren't able to work from home while they provide child care. A way to bridge that issue is to obviously to support local child care providers. And I know we've had some conversations specifically about utilizing some money from the community-based programs to prop up programs specifically targeted at those entities.
Thank you. Any other questions? Okay.
So we are asking for the commission's approval of this plan that we could then submit to the state.
I'll make a motion to approve this plan.
Second.
Mr. Chairman, before
Sure.
we take final vote, I would ask if there is any community public comment.
I don't see any.
All right.
All right. Motion's been made by Commissioner Rippon, second by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Betty, thanks for all this work and your staff and all the other people that
Well, and I also want to thank the committee. I would also like to go over, just briefly tell you what the next steps are.
Okay.
The next steps as a committee, we're certainly not done. We have a lot of work yet. We will start getting the word out on the community-based programs. Amanda, as our PIO, will work on that. Greater Topeka Partnership is also going to help us get that word out. The committee will be setting a timeline for that part of the process. We will be sending out a form to them for them to use for their requests. I don't know that we have that. I'm sure Whit O'Brien's will help us with that form. And then after that, we will have to compile these requests for our review and then verify costs as far as the eligibility requirements for the CARES Act, prioritize the needs, and then that plan will come back to you as a commission for your approval of that.
Okay.
So,
Thank you.
I also want to show here the email, Shawnee County Cares at snco.us. That is where any questions should be directed to. Any individuals, businesses, nonprofits that have questions on these community-based programs should email Shawnee County Cares at snco.us.
Yes.
Betty, if a small business applies for this, I mean, a lot of these small businesses, they don't have grant writers. They're not used to, these large types of applications and things, but is it a pretty simple process?
The survey that we sent out, and Matt might want to speak to this too, but the survey we sent out to everyone was a very simple form. There's not a lot. It's based on categories and what has already been spent, what future costs they expect. And it's a pretty simple form, and then Whit O'Brien's follows up if they have questions. Do you have anything to add to that, Matt?
Well, I think specifically for small business, the intent is to try to keep the application process as simple and streamlined as possible. So we're really trying to reduce any barriers to accessing these funds. So once we determine the size of the business that would be able to qualify, there's a couple of other program options we'll want to discuss, such as ownership structure, the types of entities, whether 1099s qualify or not. These are things we'll have some conversations about. Once we've established the type of business that can apply and how much they're eligible to receive, the intent is to really limit the amount of information they have to provide to actually demonstrate that they're eligible. So we'll have some self-certifying questions as part of the application, And then as far as documentation is concerned, depending on the value of the grant that they're receiving, that's what's likely going to be measured against how much documentation they need to provide. So if we're providing relatively small amounts, say $3,000 to $5,000, we could certainly just request a self-certified itemization of how they use those funds within the allowable activities that are provided to them. I think to keep things very simple, we probably want to stray away from offering payroll assistance so that we don't have to go through the potential burden of validating how they used Paycheck Protection Program funding, since that was primarily payroll-oriented. So there are ways to keep the program very streamlined, very simple, and even have an online application with scoring to do the vast majority of the eligibility considerations.
Great, thank you.
Okay, any other questions?
No. Thank you, Matt, and all of your staff there at Witt O'Brien. And once again, thanks, Betty and the committee. They covered 7 countries in 3 days. It was moving very fast and a lot of meetings, and I appreciate all your work you did on this. All right, what's next?
Item C, corrections. Number 1, consider the authorization and execution. Consider authorization and execution of contract C-277-2020 with KBS Inc. for the renovation of the former kitchen area of the Adult Detention Center to make a multipurpose conference area to hold remote court hearings simultaneously within the secured part of the jail with funding from the 2020 CARES Act funds.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. One of the things that we've discovered very quickly on the onset with this novel virus is that it is impacted, and very rarely does it get mentioned of how it impacts correctional facilities. It has impacted us tremendously, and the altering of our housing, altering of how we mitigate on 2 big areas. How do we stop and prevent the spread of this virus, number 1, and number 2, how do we address cases when we get it? This part of the situation we have is that we have from the onset, and Lee Welch is with us as well, with the courts, is that we have had to restructure how we handle courts, how we handle visits, how we handle confidential visits or professional visits and things like that. And one of the things that we've had to do is to make dramatic changes. One of the things is that we're looking at here is the beginning of probably 2 other COVID-related expenses, is to work with KBS on the renovation of our old kitchen area to create individual confidential rooms with soundproofing that will allow us to prevent the spread of the virus, allow us to meet our court and obligated or constitutional obligations when it comes to having inmates have access to the courts, and to continuing the visits with their attorneys, and to be able to handle what we do foresee coming down the road is more remote or virtual courtrooms and things like this. This is one of the things that, as a member on the committee, that we work with the committee members on, and working with our consultant and specifically Betty Greiner regarding, would this be something that would fit into our COVID response? And it would. We're very confident that that these funds will be available for this. And one of the things that Betty has mentioned throughout this is time is of the essence. This is something that has to get started and has to be done by the end of the year, if I'm correct. So this is one thing that we're trying to do, is to try to get these things in motion now. We are confident in working with KBS, who did get the award last year to look at this area, to be able to get this going. That I do have both Tim Phelps, monitor, and the contract monitor regarding this project, and I have Betty that would help us with finances.
Betty Greiner, Director of Administrative Services. I just want to, as Brian said very briefly, but I wanted to expand on it a little bit. This did go out, we were looking at some building things for the jail on big scale. And so we did go out for RFQ for this, and this was some time back. And KBS was the one that was selected by the Professional Selection Committee. It came to you as a commission, and, isn't that right? And you did award it to KBS. So that process has already been gone through. This is a different project, but they won the award for all of the jail and all of that. So I just want you to know that that part has already gone through our purchasing policy, so this is not bypassing that. This is just already gone through that. Also, another thing that Brian said, I wanted to just, Whit O'Brien's has looked at this project. They have gone through the plans, they have asked questions, and they have determined that this is an eligible cost.
We expect, and thank you, Betty, and we expect to, one of our future things, and I don't want to get ahead, is that we're going to have to make renovations to other areas. This is going to get bigger, and what we've seen from the attorneys, defense, police departments, probation, parole, whatever, they are going more to the virtual. So we know this is the way to head down the future, what's happening now and what's happening later down the road when it comes to, because we have no idea the unpredictability of this virus. Again, this has been very well vetted. The contracts and everything have gone through Jim Crowell and his office. The finance has gone through our consultant and Betty Greiner and the Sparks Committee. So I'm happy to stand for any questions you may have.
How soon would they be able to start?
Excuse me?
How soon would they be able to start on this project?
I'll let Tim have that. Him and Eve are going to be the project.
Good morning, Commissioners. Tim Phelps, Shawnee County Department of Corrections. My understanding is that they're going to try, they've already been doing some planning, they're going to try to start within 7 days of being notified of award.
Okay.
Because they knew this was an expedited timeline.
And maybe it's a Betty question, but how soon do we have to spend the money on this particular project?
It has to be substantially completed by December 30. So we can start spending the money as soon as our plan is approved by the state, which they have told us it will be by September 15th. So we should be able to start spending the money by the time we would get the first bill from the contractors.
Okay.
And Commissioners, just to close the loop on what she said, the contract says that they will be substantially completed by the 25th of December and fully completed by the 29th. So it falls within the timeline.
Okay.
Mr. Chairman?
Yes.
Brian or Tim, I'm just making sure that we've got on the record, the guaranteed maximum price is $994,039.
Yes, sir.
And that would be drawn from the $15,256,983 that we just approved.
Correct.
Yes.
Okay, so we're drawing down $1 million of the $15 million from that we just approved for this project.
Yes, that's correct. It would be part of the county allocation that we showed you.
Okay. I just want to make sure that it's clear on the record that we're talking about we spent from the $15 million that we just allocated from the CARES Act.
Yes, yeah. But this makes a huge difference in the whole court system and for the inmates.
And we have to, with the uniqueness of jails and the clusters that have happened, and fortunately, we've been very lucky in our agency, but jails are a hotbed for this stuff, and we have to do everything we can to protect staff and protect the inmates and everybody else, and this is one way that we can do that, and to meet our obligation standards and court-wise.
Okay.
Mr. Chair.
Yes.
Real quick, and maybe you touched on this and I didn't catch it, but this amount of money, is this just for the construction expense? Does this include furniture, fixtures, and equipment? I mean, obviously, we're going to need some serious technology upgrades in order to be doing this video streaming. Is that something that's going to be included in this, or is that going to be a separate request later on?
The only part of this that would relate to the technology aspect of it would be that the backbone for the wiring and everything will be put into the structure. They're not actually providing any technology other than the security technology, cameras and that kind of thing.
Okay, thank you.
You mean the IT part of the plan? The only part of the plan would be to put the backbone in. They're not buying devices, providing devices to us. I think right now the court's providing most of the devices.
Okay. The court is providing the
Yeah.
devices?
Okay.
Pat Oblander has also been working on a large purchase that's related to COVID-19, and I'm not sure what is included in there.
Morning, Commissioners. Pat Oblander with the Information Technology Department. Early on, as we got into this Sparks Committee and the CARES Act funding, the IT department sent out a questionnaire to all department heads asking them to provide us with their equipment needs in order to increase social distancing, telecommuting, and all those sorts of technology issues. So the specific pieces of equipment that would be involved in setting up the communications between the jail and the courts would be handled by the IT department. So we're taking care of that. It's part of the CARES funding, but it's through the IT department. So we're handling all of that for both courts and the Department of Corrections. If you have any other questions, I'd be happy to answer those.
That's good.
Very good.
Any other questions?
I would like to, Commissioner, just to kind of beef that up a little bit separately, because we think this is an ongoing issue. I'm working with our vendor that provides the tablets for the inmates to see if we can develop a software so they can just use their tablets to do their communicating rather than us having to provide them constantly.
Okay.
So that's maybe coming.
Okay, thank you.
Commissioner Mays, also, under Appendix A, under the scope description, it does indicate that there is not any money for furnishings within the guaranteed maximum price.
Okay.
So the guaranteed maximum price does not include any
Correct.
furnishings.
Okay.
Any other questions or comments?
Move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye.
Of Contract C-278-2020, Amendment Number 1 to operating agreement with Aramark Correctional Services for provision of food services to include increase in price per meal and will also allow the county to purchase certain chemicals from Aramark.
Good morning, Commissioners. Tim Phelps, Department of Corrections. This item is, it's kind of the pattern we've used since we started contracting with Aramark, where each year we look at the Consumer Price Index and consider any kind of price per meal adjustment that would be necessary for them to be able to continue to provide the meals with their mass purchases. So that is something that we've done usually this time of the year for the last 19 or so years. This has one additional component, and that is that we have, to be able to use their buying power, we wanted to contract with them so that we could get a good price on chemicals for our laundry system and for our dishwashing system, and that's also included in this amendment. I'll be happy to answer any questions you have.
Questions?
No.
Comments? I'll move for approval.
Second?
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item C3, consider authorization and execution of contract C-279-2020, Memorandum of Understanding between Community Corrections and IBSA, Inc. For state fiscal year 2021 to provide the Community Learning Center program for juvenile offenders with no cost to Shawnee County.
Good morning, Commissioners. Tim Phelps, Department of Corrections. This item is the last of the agreements we needed to enter with community partners to make use of some funds that were provided as savings to Senate Bill 367. I think Commissioner Cook may recognize that caused us to move children out of detention and into the community. And then they used those, they reinvested those funds into the communities to provide more programming to support them staying out of detention. And that's what this is, one of the programs that we had approved. The state is paying for all of the costs.
Any questions or comments?
I move to approve.
Second.
Motion's been made by Commissioner Mays, seconded by Commissioner Cook. All in favor, 3-0.
Thank you, Commissioners.
Thank you, Tim. Next item.
Item D, Public Works, number 1, consider approval of request to award the bid to Claver Construction Company, Inc. in the amount of $1,044,664 for new bridge structures to replace the culvert on Northwest Green Hills Road and the culvert on Northwest 39th Street, both over a tributary to Half Day Creek, Shanty or Cabin Creek, with funding from this big long account number that I'm going to read, and authorization and execution of contract C 280-2020 for same.
Good morning,
Don't include the account numbers, I won't read them.
Commissioners. Kurt Niehaus, Director of Public Works. I do want to apologize for that long number. That's basically a project number. That really means nothing to you. What's important is most of the money that was placed in that project fund came from special bridge funds. So on January 27th, we had a bid letting. We received one bid. Fortunately, it included very favorable prices. It compares very favorably with the engineer's estimate. It's a little over $1 million. I do want to remind the commission that this project covers 2 culvert replacements, and the replacement structures are going to be bridge-sized, and it covers significant channel work and some surfacing paving work. Just a little bit about the project. Again, I talked about we're going to end up with two bridge-sized structures. I know in the past that I estimated that the bridges would be constructed in series, but they're going to actually be built concurrently, and the reason for that is we're trying to get this work done before cold weather sets in, and quite frankly, we thought we could get better prices if we did build the structures concurrently. There will be no signed detour. We've got the people that live in the area, they know the area well. They'll know how to get to their residence, obviously. We have 46th Street, which is 1 mile to the north. We have 35th Street, which is 1/2 mile to the south. We have Rochester Road, which is 3/4 miles to the east, and Button Road, which is 1 mile to the west. Both 46th and 35th have an interchange off of US 75, so I do not see the short detours for the public being a problem. Again, this has a very short schedule. We would like to start work on Monday. We have signs out about the closures. We have a press release that has gone out. And the project will last 100 calendar days, which means substantial completion will be November 25th, just before Thanksgiving. And with that, I look forward to your questions.
Questions? I have to ask, why all the names for the creek there?
I think our project engineer or manager on this job is kind of a history buff, and he's just saying that creek, which is commonly known as Half Day Creek, maybe has other names known to other people, or historically it had those names, and so he added that.
Who knew?
Yeah.
All right, well, I'll move for approval.
You sure you don't want to rename the creek today, too? I'll second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
Thank you. Next item.
Item E, elections. Number 1, consider approval of request to post and fill a soon-to-be vacated election manager elections system position at a starting salary, including benefits, of $63,580.64, and to fill any current positions that become vacant as a result of filling this one.
Good morning, Commissioners. Andrew Howell, Shawnee County Elections. Just, we are having a vacancy that's going to occur fairly soon. We'd like permission to fill that position. That position in the office is actually a position that actually helps to build the ballots and prep those, so it's something that's pretty necessary that we get right on, so we'd appreciate your consideration.
Any questions? I'll move for approval.
Second.
Motion's been made by Commissioner Rippon and seconded by Commissioner Cook, I guess. All in favor, say aye. Those opposed, motion carries 3-0. Next item. Thank you, Andrew.
Item F, facilities maintenance. Number 1, consider approval of request to utilize contingency funds not to exceed $7,500 to remove defective motor on courthouse elevator number 1, and contractor repairs to elevator number 3 to keep the elevators running until.
Director of Administrative Services. As you know, we are having problems with the elevators. We have contracted to have the passenger elevators replaced or modernized, I think is the correct term, modernized. So this is what we are asking for contingency money up to $7,500, basically to handle the repairs to keep those, at least 2 of those elevators going. I think right now 1 is completely down, and we're using that one for the parts to keep the other 2 going. So we're just asking for contingency funds to handle those repairs. So do you have any questions?
Any questions?
I'm looking forward to the day where we don't have to talk about elevator improvements.
Aren't we all? Yes.
I've moved to
yes.
approve.
Second.
Motion's been made by Commissioner May, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Betty. Next
you.
item.
Item G, Parks and Recreation, number 1, consider authorization and execution of contract C281-2020 with the Sertoma Great Topeka Duck Race Committee to provide the 25th Annual Great Topeka Duck Race on September 19th at Lake Shawnee, with organizer to pay expenses of $540 to the Building Maintenance Fund and a $500 special event fee.
Good morning, Commissioners. Randy Luby, Parks and Recreation. This is our annual contract Topeka Duck Race. It is going to be a little bit different this year. It will be held on September 19th, but they will not be having a festival like they've had in the past. It'll be just the duck draw can come out, but they will be practicing social distancing if they do. Be glad to answer any questions you may have.
Questions?
Are they going to be broadcasting this to where people can watch online the duck race?
I don't believe so,
Okay.
not to my knowledge anyway.
I'll move for approval.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Randy. Next item.
Item G2, consider authorization and execution of contract C282-2020 with the Boys and Girls Clubs of Topeka for the continued management of the Juan Poppy Abbott Community Center from September 1, 2020 to August 31st, 2023, to include the county being responsible for maintaining the facility at a rate equal to 3% annual after the first year of $10,000.
Good morning, Commissioners. Randy Luby again. This is our agreement with Boys and Girls Club. Don McWilliams could not be here today, but we are very proud of this partnership. If you recall, probably 6 or 7 years ago, we didn't know what Abbott Community Center was going to hold. We got out of a contract with a vendor that basically only had about 3 to 4 kids using it a day. The Boys and Girls Club came in, and between our partnership, they were able to fix up the Abbott Community Center, and now it's a teen center and holds about 135 kids a day. So we're very proud of this partnership, and I think it's one of the most successful ones that we have had. Be glad to answer any questions you may have.
Randy, before the city passed the Abbott Center over to the county, at some point in the past, on the east side of that building, they excavated, cut a channel for a drive up or drive down to the basement. That basement has flooded, it continues to flood, it's been an issue. In talking with board members there, if we can have an architect, and I think the Boys and Girls Club is having an architect looked at it, is there the possibility that we might want to just close that back up, fill that in if it's not needed, if it's not a fire or safety issue, and then have the county, because the Boys and Girls Club has put a lot of time and money in, there's been resources donated to have that basement renovated, but it continues to flood, and it's a cost to the entire community.
Yes, Commissioner, we are. Actually, John Boyd has contacted our in-service architect that's going to be looking at that, of trying to come up with a a permanent fix, not a temporary fix, and see what the costs are, and we're investigating that now.
Because if we don't need that loading dock, it may be best served just to fill it in and stop the drainage.
You're absolutely correct.
I know a little of the history of that. That ramp was put in to provide ADA access to the basement when it was many, many years ago.
And that was for the East Topeka Senior Center that is at the Rice Community Center. But we may not need that ADA access to the basement since there's no seniors meeting down there anymore. But
Yeah,
that channel, that ramp just floods and.
It floods.
Yes, it does, and we'll definitely be looking into that.
Okay. But if we do look at that, would that be something covered by the county? Since again, that is a continual issue for the Abbott Community Center in that it floods and floods and floods, and it may be in excess of $10,000.
Yes, actually, the $10,000, if it exceeds $10,000, there's clause in the contract that, Boys and Girls Club could pay for it, but I know their money's limited, or they could come to us and we could request to the Board of Commissioners money to pay for that item.
Again, looking at it, depending on what the engineers say, we may be using dirt or other fill if it's not necessary at all, or some way to stop that flooding. It's got to be a higher priority.
I will do that, Commissioner.
I'll move to approve.
I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Okay, item G3, recognition and ratification of the appointment of Judy Gatewood to the Parks and Recreation Advisory Advocate Board as recommended by City Council Member Karen Hiller, City Council District Number 1.
Good morning, Commissioners. Randy Luby again. Ms. Gatewood has worked over 30 years in Shawnee County. She volunteers time at Keep America Beautiful and has also been on the advisory board for the Hills Bark Park. I feel that she'll be a value-added member to our advisory board. I'd be glad to answer any questions. I did invite Judy here, but she wasn't able to attend.
I'll move to approve.
I'll second. Motion's been made by Commissioner May, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item G4, consider the reappointments of Teresa Miller, Laura Burton, Jim Martin, and Kathleen Cummings accepted by members to the Parks and Recreation Advisory Advocate Board.
Again, Commissioners, Randy Luby. All these members are returning. Their term ended last month's board meeting. We're very pleased with the value that these members have brought to the advisory board, and I stand for any questions.
Move for approval.
Second.
Motion's been made by Commissioner Cook, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you, Randy.
Thank you,
Next item.
Commissioners.
Item H, Health Department. Number 1, consider authorization and execution of contract C283-2020 with the City of Topeka to receive $166,389.30 from the Community Development Block Grants for the establishment of a testing facility for additional COVID-19 testing and expansion of the strike team's service with no cost to Shawnee County and no match required.
Good morning, Commissioners. Linda Oaks from the Health Department. Way back in March, the City of Topeka approached us, Betty Greiner and myself, and told us that there was money in their Community Development Block Grant that was supposed to go just for COVID testing. And so we thought at that time it made sense to partner with them since we were already going to be doing testing. So we have been working since then to work out this agreement. It has already gone to the city, and I believe they have approved it. They've not signed yet, but they have approved it. And so this money will come to the county for us to help pay for rent if we find a place that we can use for testing, and to develop those, I call them strike teams of nurses and staff that can go to businesses and facilities to do testing when we have positive cases there and we want to see how widespread the virus is. And so, again, there's no match, there's no, we just get the money. So I'd be happy to answer any questions.
can it be used for salaries too?
I believe this grant, we have focused all on rent and testing supplies, that we have other grants that are covering the salaries. And Betty, feel free to correct me. Okay.
Okay. Any other questions?
No.
I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item H2, consider authorization and execution of contract C-284-2020, amendment to contract C-227-2020 with Biodefense Network to allow additional hours to conduct contract tracing for Shawnee County COVID-19 cases at a cost not to exceed an additional $10,000 per month to be paid by the COVID-19 grant funds.
Good morning, Commissioners. Linda Oaks from the Health Department. As you remember, on June 18th, we entered into an agreement with this company to do our contact tracing disease investigation for us. At the time, I was guessing how much time and money we would need, and I guessed low. That's what's happened. And so we are asking to add an additional $10,000 a month to their contract so that we can keep sending them cases. In the meantime, they have spent a lot of time hiring people and getting them, we've got them trained, and so they've really geared up to help us. And for instance, today we have 30 new cases. We'll be pushing out a lot of them to them. So they really have helped us a lot. And they've enabled us to start immunizations again, to get some of our staff back to their other jobs. We've also been able to take the WIC nurse and a couple of nurses from MCH and put them back in their other roles. So it has been a tremendous help to us. I think they've done a good job, and I'd like to continue working with them and being able to send them more cases. And I'd be happy to answer any questions.
Mr. Chairman. Lintrack tracing and the biodefense and what they do and how they do what they do. And I know that we've been utilizing them for about a month now.
A little more.
Is there a way that we could have maybe a presentation on what we've seen and maybe looking at, either next Thursday or the following Monday, the 24th, from either the Biodefense Network or somebody, or from your department, stating this is what the benefit is?
Sure.
When we're talking about $10,000 a month, even though this is not directly taxpayer money, it is still taxpayer money in the end. And what are we getting for our money at, now up to $20,000 a month?
I'd be happy to do that. I probably will do the presentation and ask one of them to call in, but I'll have to check with them on a date they're available.
That would be really helpful.
Sure.
I think that there's a lot of questions in the public about what contract tracing is, and there's a lot of questions about what they do.
Absolutely. Be glad to do that.
Okay. So,
I'll move to approve.
okay. I'll second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you, Commissioner.
Thank you, Linda. Next item.
Item I, Commission, number 1 has already been taken care of. Number 2, consider approval of resolution number 2020-48, establishing the 2021 holidays.
I will move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item I3, discussion of plans to accommodate office staff.
All right. Did we have we don't have the plan here, do we, or anything?
I have one on my desk.
Well, we might bring that in, just,
I know Bill was here, but he had a meeting that he had to leave
Okay.
for at 11. So I don't know what all he was planning on covering.
okay. I think they were going with option B, is that,
Well,
is that?
Mr. Chairman, I
Or-
think that, without Bill here, this item I don't know if we want to defer it till Thursday, because there really does need to be public discussion about what this item is about.
Thank you.
I know that Bill Kroll has met with each of the commissioners individually regarding changing the configuration of the Shawnee County Commission offices now that we've added additional staff. But for public, there would be an agenda item about preliminary discussion of reconfiguration, and then we would have it would go out to an architect and then come back with options. There would be discussion on those options, approval of an option, going out to get bids on that option, and then approval of final contract. And so I think we've maybe kind of skipped a couple of those steps in this process, but I think that we do need to have public transparency about what we're looking at, since we are going to be expending taxpayer funds with the additional staff that we've hired on.
All right, so you want to defer this till Thursday, and then we can have,
Do we need to defer, or can we just talk about it? I mean,
Well,
I think it's not like it's a big secret. Okay, so we added a couple of new staff members. We're having to make a place to put them in our office, and
I think the part that there was no public comment on is, I mean, it's my understanding that we're looking to spend up to $10,000 with a contractor, and that these were done by a phone bid, of which Bill is the person that did the phone bid.
okay.
So if we're going to be talking about our purchasing policy, expenditure, how we came to that amount, and who we suggest, we also don't have a memorandum in the agenda today. So
we were going to use COVID funds for construction. It's my
We've looked
understanding,
at
or
that,
try-
and I don't know that this will qualify for
Okay.
the COVID funds.
All right, well, okay, well, I've moved that we defer this till Thursday, and
Second.
motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0.
And just for clarification, that's Thursday, August 20th?
yes.
Yeah.
Thank you.
Okay, next item.
Item I4, discussion of the 2021 budget.
Okay, I'm back again. You can't get rid of me today. Okay, we are here to continue our discussion on the 2021 general fund budget. Just to refresh your mind and that of the public's, you had made a suggestion, or you had voted preliminarily to use 2.5 million of reserves in order to keep the mill levy at approximately the same rate as last year and not to increase that. You had distributed that excess money to several departments: Community Corrections, District Attorney, Parks and Rec, Vallejo, and Elections Office. I think it was left that you wanted to think that over and revisit it today.
Any questions?
No.
Okay, well, I had a chance to review it, and I'm happy with it, so I'll make a motion to approve.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0.
Thank you.
Thank you, Betty. Next item.
Item 5, administrative communications.
Okay, this time, if anybody'd like to make any public comment, do so now.
Good afternoon, Commissioners. Tim Laurent, Shawnee County Parks and Recreation. I wanted to take a minute and just introduce a new employee. Chris, if you could come up here. This is Chris Curtis, and he's filled our project planner, project manager / park planner position that we've had open for a while. I don't know if you guys recall who might have been in that position prior, but he may or may not be in the room. But again, this is Chris Curtis, and I'd just like to let him maybe introduce himself and say a couple of words.
Good morning, Commissioners. Chris Curtis, as Tim said, I'm the new project manager and park planner with the department. Excited to be here. Came here via Salina. Got over 20 years of Parks and Rec experience in Lawrence, Dodge City, Manhattan, and Salina. So excited to get started and glad to be here.
Thank you. Welcome aboard.
Thank you.
All right.
Thank you.
Good morning, Commissioners. Lee Welch, Court Administrator, Shawnee County District Court. I'm going to start off by apologizing to Commissioner Mays for talking about elevators. Court Administration met yesterday with Sergeant Lutjohn from Shawnee County Sheriff's Department, and members of Brian Cole's staff who handle transports and holding here in the courthouse. Given the existing issues that we're having with the elevators and the fact that beginning Monday, the inmate elevator will be taken down until approximately September 30th, we've been desperately trying to figure out how we're going to handle 7 divisions of criminal hearings without reliable transport and safe transport for inmates. There are some options that we talked about with Bill Kroll yesterday, but basically what we're trying to do is reconfigure our courtrooms, reassigning locations to the best of our abilities to not have to use the elevators any more than need be. We have given serious consideration to closing the courts again, just because of the issues that it's going to create for the next 6 weeks until that inmate elevator is back up and running. So what I'm doing is requesting permission or requesting your consideration to allow the courts to use any available spaces and perhaps the basement or the first floor, such as the commission chambers when they're not in use, the break room. I have a call into Mike Kagay to talk about using some of their available space. We're just trying to eke out any sort of space we can use as a courtroom so that we can keep the courts open. We're doing as much as we can by Zoom. We've encouraged our judges to do even more by Zoom. There are limitations that Brian spoke about earlier with the Department of Corrections. He can currently accommodate up to 6 tablets, but only 3 are reliable given Wi-Fi deficiencies and sound issues that they currently have in some of the spaces at the jail. So we have 3 reliable Wi-Fi connections to the jail, and we're, like I said, encouraging all of our judges to do as much or more than they currently are electronically. So I'd be happy to answer any questions, and I appreciate your consideration.
How many different spaces are you looking for?
It's going to just depend on the day. We're trying also to reschedule some, we have some standard days that have certain hearings. So we're trying to do some of that rescheduling. We're also in the midst, just like I'm sure everybody else in Shawnee County is, with online school. We have a great number of staff that we're going to have to work around that are going to be home with their children. So we're trying to realign schedules for staff who have to be home for online school, as well as the elevator issue. So I honestly can't tell you on any given day how many spaces we may be looking at.
Chairman, I have no issues with the courts utilizing the chambers when we're not meeting. Additionally, if we're going to be going to the Great Overland Station, that may even provide additional opportunities for the use of the chambers. At the same time, if they can utilize the employee break room, that would provide one additional space. And I know that Court Services has a conference room that they would be able to utilize in addition to the 2 courtrooms that are already in the basement.
We've actually relocated some hearings from B22B into the Court Services conference room so that we can have some of our CAD dockets in B22. So we're already shuffling some of those around.
But I would ask that I see no issues with those requests, and I think that we should do everything we can, given that period of time that the inmate elevator is going to be inoperable for the next approximately 45 days.
Yeah, I would agree.
Yeah, I think this room actually probably makes a pretty better courtroom than a commission chamber. So.
I met with the courts, with the Great Overland Station. We looked at the possibilities there of maybe a place where they could do jury selections, but that was later in the year, what I gathered. So maybe moved up a little, I don't know.
Well, we have to have a written plan in place. Has to be approved by the local chief judge, which we're working on right now. Has to be also approved by Dr. Pizzino, and then it'll need to be approved by the Supreme Court. We do have a rather high-profile case that's scheduled to begin October 26th, so we're hoping, perhaps, maybe we'll get to actually have that jury trial. Jury selection, in all likelihood, will either take place at Ag Hall or Great Overland Station.
I do know we have an air conditioning part that's an issue with the Great Overland Station now. I think that part is in California or somewhere right now. Hopefully we get that back and so we can get operational.
I'd be more than happy to go get it, just to avoid.
I'd have to
Avoid
quarantine
this.
you for 2 weeks. And you come back.
That's okay.
All right, but that doesn't require a vote, I
Okay.
don't think.
Yeah.
Thank you very much. I appreciate your time.
All right, thank you very much. Anyone else? Commissioner Cook, do you have any?
I do not.
Commissioner Mays?
Nope.
I do not have anything, but we session. So I'm going to make a motion to go into executive session for a period not to exceed 10 minutes for the following reasons: to discuss personnel matters of non-elected personnel, specifically to decisions not to exceed 10 minutes. No action is expected at this time. So,
Second.
motion made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries 3-0. A long one. We are back in session, and no actions taken at this time, so we're adjourned.
Sir, that's the one you have over there, that's, you have two of them, Mr. Cook. The one's a no, the other one's a sign. Okay, so, find it.